does the horse stamp the affected limb as though it has pins and needles. This horse starts work moving reasonably well. The head and neck carriage is not entirely consistent, but the horse appears reasonably willing and responsive to the rider's cues. But as the work progresses, we begin to see that there is more mouth opening. And the horse's head and neck position becomes somewhat less consistent. The horse canters reasonably willingly, but is starting to make a grunting noise, and this respiratory noise becomes progressively louder with continuing work, perhaps reflecting the horse's discomfort. The horse is maintaining a regular rhythm and continues to be responsive to the rider's cues. However, now the head and neck position has become lower and the horse is beginning to show an obvious right hind limb lameness. And a head nod mimicking a right forelimb lameness, reflecting the right hind limb lameness. The speed of progression of clinical signs varies hugely among horses, and this will depend in part on whether or not there is unilateral or bilateral involvement and the severity of vascular occlusion. In order to verify the diagnosis, the aorta, iliac and femoral arteries will need to be evaluated ultrasonographically, appreciating not that the entire length of the iliac arteries can be examined. You need to evaluate the horse as soon as it comes to a standstill to assess the distension of the saphenous vein, which normally will not be distended, and the metatarsal pulse amplitude. The limb may be cooler,